A silent health crisis affects millions of men, but most don't know the signs. Ignoring this one condition is linked to a much higher risk of all-cause mortality. And if you think this is only about aging, testosterone levels are dropping in men as young as 15. This condition, hypogonadism, affects up to 40% of men over 45, yet it's massively underdiagnosed. In the next few minutes, we'll expose the real symptoms and show you why science-based education is key to taking control. The biggest barrier? The myth that feeling weak is just a normal, untreatable part of getting older. It's not. This is compounded by a wall of silence. Stigma leads men to avoid doctors and turn to unreliable online searches. But what they find is often incomplete. Testosterone isn't just about libido, it's a master hormone. This means the real warning signs are often hiding in plain sight, mistaken for something else completely. First, your mental state. Low T can cause depression, brain fog, and crippling fatigue. Your brain needs it. Look for physical changes too. Trouble losing weight, insomnia, even nerve pain. It regulates your metabolism. A slow 1% annual decline after 30 is normal. A sharp drop with severe symptoms is a clinical issue. Do any of these hidden symptoms sound familiar? If so, you might ask why it's not caught more often. With so many men affected and symptoms this widespread, why is hypogonadism so difficult to diagnose correctly? Part of the problem is a flood of online misinformation, pushing men to demand TRT for vague symptoms like tiredness. For doctors, the non-specific symptoms mimic many other conditions, requiring specific fasting morning blood tests. And low T often hides behind obesity or diabetes. The symptoms are blamed on the other condition, so the root cause is missed. This diagnostic maze leads many men to a dangerous place, self-treatment. But this world has its own myths. Men buy unregulated online supplements, risking infertility, testicular atrophy, and blood clots. Real T is a controlled substance. A major fear is prostate cancer. But modern evidence shows TRT is unlikely to cause it, though it can reveal existing issues. Still, some debate on long-term safety persists, which causes physician hesitation and patient confusion. This confusion is dangerous. Recall that increased mortality risk? The greatest danger isn't from treatment, it's from inaction. So why is it so hard to diagnose? A storm of vague symptoms, stigma, and misinformation leaves men untreated. Let's be clear about the stakes. Untreated low T is strongly associated with a higher risk of heart attack and stroke. It also silently degrades your skeleton. Chronic low T leads to decreased bone density, raising the risk of fractures. So the choice isn't between a controversial therapy and nothing. It's between informed treatment and a high risk of severe disease. We have a widespread condition, misunderstood by the public, and incredibly dangerous to ignore. The solution isn't hype or quick fixes. It's accessible, evidence-based education that helps men understand their bodies. This is the mission of platforms like hypergonadol.com, to provide that clarity without the sales pitch. Don't let myths or misinformation dictate your health. Arm yourself with knowledge. Learn the signs. Understand the science. Your health is too important to leave to chance. Take the first step towards informed wellness today.